Okay, my name is Sonja Durinck. I'm originally from New Zealand, however I've lived in Canada now for 20 years and I was diagnosed in 2011 with ectopic Cushing syndrome. After going to the family doctor for several years with different symptoms each time I visited, I went in the final time after I'd stopped work. I stopped work in the morning, I went into the office, I said, I've only been here 6 months. I don't normally look like this. You don't know what I really look like. I have to go and find out what's wrong with me. I just can't do this. So I called into the doctor's office. I said, come on, we've got to find what's wrong with me. I've stopped work this morning. And I said, so have we done all the hormone tests? I swear that it must be something to do with the hormones. Go through everything to check whether we've covered all the lab tests. I'm losing hair on my head, and now I'm growing it on my face, and I look like a werewolf. And he looked a bit closer, and he said, oh. So he said, yes, we've got 2 more to do. So the next day he phoned me, come in and see me. I went in, and he said, oh, I'm so sorry. It looks like you've got Cushing's disease. So he was very apologetic, and he followed me continuously from there on. And that led me to the internal medicine, and within days I was with the endocrinologist. And the amazing thing with the endocrinologist was they came out to get me, and she was so excited. She said, I'm so excited, I couldn't wait to see you today. And I looked and I thought, what? And I said, what did you just say? And she repeated it. And I said, doctors don't get excited about seeing patients. She said, do you realise how rare you are? And that really calmed me again, that, hey, I found the right place. I'm going to be made better. And I didn't put my hands up and say, I'm going to be made better, but it's a responsibility of the patient too to help themselves get better. For the start of my journey, I found that I was visiting the endocrinologists every week. They kept monitoring me. And I was struggling now. It was very difficult for me to be able to walk. I was finding my speech was starting to go. We still couldn't find the culprit of what was causing this Cushing's. So they suggested that I have an IPSS, a test that they put through the groin, and then they monitor into the brain near the pituitary to see whether you have a pituitary tumour. And there was nothing there. So we had all sorts of internal from the neck down, from the bottom up, to see if we could find anything, and still nothing. And I went in the early May to see the endocrinologist. This was from February now to May. And 2 of the endocrinologists were there, and one said, how are you feeling? I said, I am so sick of feeling sick. Well, Sonja, we want to admit you now. And I said, oh, well, I can't. I've got blood tests, I've got an ophthalmologist this afternoon. And I was still trying to drive myself to keep that body going and have the independence. And she said, well, if you're still not well by the end of the day, give us a call and we'll find a bed. So I went off and had all the tests, and I got into bed very early in the evening because I did sleep a lot. And I had a call at 11 o'clock that night, and it hung up, and I thought it was my daughter from New Zealand indicating she was going to call. The phone went again. I climbed out of bed and tried to race there to the phone. And I get the call, and it was the doctor. Sonja, I want you in hospital now. And I said, I'm not working with a time bomb. She said, you must come into hospital now. What took me in was my potassium had dropped to 1.7. So I was in hospital for a couple of weeks as they did perform tests, tried drugs to suppress the cortisol levels. My cortisol and ACTH were about 4 times the normal. And I was just a great big balloon, and that was really the journey. We could not find the tumour or anything that was causing the ectopic Cushing's, and so to keep me alive they removed my adrenal glands, both bilateral. That was another journey that took on. Not knowing my medications, I couldn't remember the right medications, even though they'd been written down. My concentration, my comprehension had just gone right out the door. I lived on my own, so I had no support within the house. Friends around didn't really understand what was going on other than I looked really sick. So I ended up with multiple fractures, and my last fracture was the pubic bone. I'd woken up in the morning and I couldn't get out of bed. And these breaks just happen because of the cortisol levels. My bones had started to crumble. So I ended up in hospital then for another 6 weeks. And when I first went in, an endocrinologist said, "Sonja, you're staying here until you're sick of being in hospital. We want to make sure you're going to be okay to be able to go home." So 6 months later from the first surgery, in the November, we then found the tumour. And it was small, another carcinoid, another neuroendocrine tumour in the same place, right where the staples were. We couldn't get a biopsy because it was because of the location. But I lived with that tumour until 2017, and my ACTH levels were still really high. They were around the 171, 172. So I kept questioning about it, so I saw a thoracic surgeon, and his immediate reaction was, "Well, we'll just take your whole lung out." Well, I want to talk about this. I want to discuss this. So I decided that I wanted to investigate further into that field. I met up with a doctor from Bulgaria and talked to him. He was a neuroendocrine doctor, and he just asked the question, "Well, the tumour that you had in 2002, did that show any ACTH staining?" And I said, "Well, really, I don't know, but I happen to be seeing the thoracic surgeon next week." So when I got to see him, I asked him, and he looked it up, and there'd been no report on it. So he said, "Being a university hospital, we save these tumours for at least 20 years, so shall we pull it and get it retested?" And I was kind of surprised and said, "Oh, you would do that?" And he said, "Sure." I said, "You know what? Go ahead and do it, because you're going to learn something and I'm going to learn something from it." So within 2 months he called me at home and he said, yes, they found ACTH staining. So could I have been diagnosed back in 2002 with Cushing's? Could I have been diagnosed back in 1994 when I was suffering and complaining about the pain it was for me to be able to breathe? And I couldn't get oxygen into my lungs. I didn't feel I could get oxygen into my lungs. Well, that must have been the first tumour then. So I can look back and say, what if? Well, it didn't ever happen. It happened in 2011, and we've gone forward from there. I got the opportunity to meet up with a radiation oncologist in 2017, and they felt that they would be able to target the tumour so that I would still have a little piece of lung left as opposed to getting all of it removed. And so I looked into that with them. They share everything with me so that I can too make a decision on what medical interventions I'd like to have. So I opted for the radiation as opposed to the surgery. And again, I'd seen the cardiac surgeon because they knew that they would have to bring him in if it was going to be surgery. And within finishing that, and about 6 months later, I had some more blood tests done. I asked for the ACTH test to be done, and it came back. My ACTH had dropped from 171 down to 65. So for me, that said, "You guys, you targeted it. You got it." So I'm still being monitored every 6 months, either by the endocrinologist and the endocrinologist and the oncology radiologist. So I've got a wonderful team. So during this period of time, and even before diagnosis, my friends were noticing a difference in my appearance, and a friend who's Dutch, she would often come to me and say directly, "Are you on prednisone? Are you on prednisone? Look, your face is getting bigger." And I, no, I'm not on anything. I'm going to the doctors and I'm trying to get diagnosed. But after diagnosis and hearing how rare this condition is, I'd mentioned it to somebody else and they said, "Cushing's, oh, that was on Dr. House. Oh, that must be really rare." Yeah, I guess so. So they were there to kind of support but really didn't understand. And I still was learning myself. The hardest part was to tell my daughter. She lived in New Zealand and she was planning her wedding. And so I was always trying to tell the doctors, "I've got to be at the wedding, I've got to be better, otherwise if I can't fly I'm going to have to start paddling in a canoe to get there." Unfortunately, I missed the wedding. I was unable to fly to Fiji. So that was a disappointment, but at the same time, here I was, this humongous mother, that I was so conscious of my weight and my size. Even with my friends, I stopped answering phone calls. I didn't answer emails. I didn't answer the door if people came round to knock. I was so conscious of who I was going through this. I just loathed it so much. If there's one word that would describe who I was before I got this, would be organised. One word, I can't do it in one word to describe my journey through diagnosis, but what was there was I never lost my sense of humour. One word to describe me now, and I'm now still 8 years on, I'm not the social butterfly I was. To anybody who's been newly diagnosed, encourage your endocrinologist to sign you up with a support group. Vitally important to have a support group, to have somebody else to talk to. CSRF have been really important to me. They were the first support group that I came across on the web. They had a list of people who were had newly joined, which they do each publication they put out. And I was always looking for the person who had ectopic Cushing's. And I found one. And the first person was out of Namibia. And so I've still been in touch. We're still in touch and keep in contact to know that we're still there to support one another. But it certainly was not in North America. It was globally. And that's been just beautiful. Having attended the Patient Summit in 2019, I've reaped so much. It's been so rewarding to have met more patients. Yes, there were only three of us with ectopic Cushing's, originally ectopic Cushing's, but we're able to share what we're going through. They might have had their tumour elsewhere in the body. No person is the same. But the added advantage is that we can share our stories also with the physicians that are here, and we get more learning from the physicians and the clinicians. And I think that's really important, to be able to build that relationship. No longer are the doctors stood on a pedestal or on the other side of the desk saying, "Here's your script, come back and see me in a week." It's now a discussion between the two, or how many are in the room. And I really find that beneficial by coming to these summits and getting that sharing experience.